A Good Samaritan Hospital in West Islip recently expanded its emergency room to include a pediatric ward and a level 2 pediatric trauma center. Joining us now via Skype is Dr. David Gold, a pediatric gastroenterologist at Catholic Health's Good Samaritan Hospital. Thank you so much for joining us.
Great, thank you for having me.
I'm checking it out. You are in the pediatric emergency room, right?
I am in the pediatric ER. Unfortunately, we can't take you around due to the conditions, but it is a beautiful site.
We do have some video that there we go, of this new emergency room. Tell us how it is different from, the old emergency room at Good Sam.
Yeah, so it's a welcome addition. It was a long time coming. Previously, the ER was based in the adult ER, and the children really had to commingle with the adult patients. Hospital visits in general could be quite traumatic for children, particularly in the emergency room setting. And given the hustle and bustle of the adult ER, which is constantly on the go, having an independent space is really a nice thing, much more comforting, much more warm environment for the children. And they did a really beautiful job here.
Mm-hmm. Well, we saw from the pictures, it's nice, warm, bright paintings, look like a board that they could, color on, sort of things to maybe distract them a little bit when they are very frightened to be in an emergency room.
Exactly. It's really geared towards children, and it's a nice large space. There are 12 individual rooms. We have 2 isolation rooms as well. And most importantly, they have their own waiting area, which is really perfect. So it's, again, a very non-threatening environment for them to come into. And again, we have a dedicated pediatric emergency room staff. We have excellent child life support, which is here to help the kids as well in scenarios where they're having issues dealing with it. So really, it's a win-win, I think, both for the hospital and for the community.
Any parent who has had to bring their child to an emergency room, which many years ago I did, my kids are all grown now, but I love the fact that it is a large waiting room just for the parents and their kids. And when you just said, 12 treatment bays, too, to get the kids quicker into their own, separate area from everybody else, that has really got to help a lot.
Yeah, absolutely. I mean, trying to minimize time in the hospital setting really is terrific. And like I said, it's the flow is much better, and just the whole environment is really a nice place for the kids.
Tell us about the Pediatric Network, the network of care there at Good Samaritan.
Yes, unfortunately, I'm fortunate to be able to work on a cohesive pediatric team. The Pediatric Network really starts in the hospital with the Peds ER, but we do have a dedicated pediatric floor with 20-plus beds up there. And we have a standalone pediatric ICU with 3 dedicated pediatric intensivists as well. So I do see patients here at the hospital, but the bulk of my time is spent over at the Center for Pediatric Specialty Care. And that, again, is a standalone building over on Deer Park Avenue in Babylon. And I work there with my partners, but really all the other pediatric specialists who are part of the pediatric team here at Good Sam, we're based out of there. And the nice thing about that is that we're all under one roof. A lot of the kids that we see have issues, again, that are multidisciplinary. And from a gastroenterology point of view, we have a lot of overlay with neurologic complaints, with pulmonary complaints, with endocrinology complaints. And having the individual physicians available there for patients who have multiple needs both makes it very easy for families who may need to see more than one doctor. But I think more importantly, when there's communication of cases, when you need to communicate with the other doctors to coordinate care, to discuss complicated cases, again, when we're running around to different sites and different centers and trying to find the person involved in a patient's care, it can be very difficult to sort of track somebody down and discuss a case. Here, all I have to do, if I have a complicated case or I need to ask the neurologist a question, I can just walk down the hall, find them, run the case by them, and get back to the parents pretty quickly and pretty promptly. So really having this under one roof, sort of dedicated site, sort of tied into the hospital, really, like I said, it makes it a much, much better situation, I think, both from the family's point of views, but I think even from the physician's point of views.
Yeah, so nice. You just mentioned a little bit ago, too, about the child life specialists at the hospital. What do they do?
The child life really helps to adapt the child to the hospital setting. They'll review procedures, go over blood drawing, intravenous lines. They'll really sit down a one-on-one with the children, and really they're remarkable how well they work with the kids and sort of bringing down that sort of stressful situation into a much more manageable one. And we have an unbelievably terrific team here.
That really has to help, obviously, the parents and the kids, but also you as a doctor.
Oh, absolutely. The calmer the child when you walk into a situation, especially when I do procedures here at the hospital. Again, there's intravenous, there's lots of people coming and going. And they're pretty much here from the time the patient arrives until we do the actual procedure, essentially holding their hands, talking them through it, distracting them, keeping them occupied. And they do really an unbelievable job.
Now, has the coronavirus impacted your young patients this year?
It's impacting them, not so much in the office setting. We've certainly had patients admitted to the hospital with COVID, so this is not just an adult disorder. Obviously, it's affected us just in the ability to see patients and how we're going about our day-to-day visit, as it is across the country and across the world. Essentially, we are taking precautions in the office. We are screening patients, families, temperature, questionnaires about symptoms. We're screening all the staff when we arrive in the day with the same kind of screening. And we're limiting the ability, unfortunately, we're limiting to one parent per visit for the children. We're trying to minimize backlogs in the waiting rooms, having patients waiting outside with the families in their cars, but trying to keep the flow and separation adequate. And we're all wearing protective gear, sanitizing the rooms. But we are now offering telehealth as well. And we recognize that there are some parents, some families that are uncomfortable coming out in this world that we're living in. And again, we don't want to be losing the ability to take care of these patients. So for patients express concerns about coming to the office or have situations at home with a family member who's higher risk and they're worried about being exposed, we have been doing a lot more telehealth visits now to ensure that continuity of care is still occurring. We heard a lot, I think, early on in the pandemic about people not coming to the ER when they were sick and should have been,
Right.
and seeing other problems escalate because of this fear of seeing the doctors. So I think telehealth is opening that up a little bit as well.
Are you seeing more people with the stress of this year seeking help for GI issues that may be related to stress?
Well, in the GI world, stress is a huge factor for even without the COVID world we live in. But yes, I think, again, the whole school situation, the social isolation on the patients, we're definitely seeing increased stress related to COVID. I'm not sure I'd necessarily seen the children themselves being concerned that they're going to catch it. Seeing maybe a little bit more in the teenagers, but just the fact that they can't go about their normal lives as they did before, their sports, their interactions, their mix of hybrid school versus going to school full time. And I am definitely getting some patients, again, where they're switching totally to virtual because they are stressed about being in the school environment. And again, I'm not sure that's necessarily as good a situation for the children. I think intermingling is important.
Yeah, boy. When should a parent seek your help? That, okay, this is more than a stomach ache. When do I need, a specialist's help?
So again, we always talk about looking for red flags, concerning symptoms, unexplained weight loss, unexplained vomiting or bleeding from the GI tract, symptoms that are waking somebody from sleep. But really, if it's affecting quality of life, okay, or if you're trying standard first-line therapies, you've seen your primary doctor, they've made suggestions, those initial suggestions are not helping, then I think it's the next step is to come see a gastroenterologist.
And we just did see you are taking precautions. We could see everybody separated in the emergency room and at your offices. So best advice, do not hesitate to call the doctor or come see the doctor.
Correct. We're still available to see patients and we're doing it as safely as we can.
Love the emergency room. Thank you so much. Not going there, but I like the, it looks great for the kids. So thank you, Dr. Gold.